We're joined now by one of Forest Park Medical Center's founders and craniofacial plastic surgeon, Dr. David Genecov. Dr. Genecov, thanks for being with us today.
You're welcome.
If you would start off by just talking to us a little bit about what brought you to practice medicine and specifically craniofacial plastic surgery.
I grew up in Dallas, and my father was an orthodontist here in Dallas, and he became part of the first craniofacial program down at UT Southwestern, or Children's Medical Center, in the late 60s, early 1970s with a physician named Ken Salyer. And so early on, I would see what my father did on the orthodontic side and still get to see what Ken did on the craniofacial side. And the transformations that the two of those guys did in the lives of children and their families I thought was extraordinary. I've always wanted to do craniofacial surgery. It's really the only reason I went into medicine, to be honest, was to be able to take care of these kids.
Wow, and talk to us about what is the most rewarding aspect of your job.
I enjoy taking care of patients from when they're small to when they're almost 18 years of age. I get to take care of kids almost for as long or longer than some pediatricians. Additionally, families move, but most of my patients, a vast majority of them, come back to see me on a yearly basis. So I get to watch them grow and see them mature over time, and I really enjoy that. The other thing I probably enjoy as much as anything else is the ability to take a child who is otherwise has low self-esteem, or the environment looks on them differently, and if there's something that we can fix or enhance or improve, we do that, and the change it makes in that child, both physically, mentally, and with their self-esteem, to me is life-changing for me, and that's the main reason why I do it.
That's wonderful. You've been an integral part of the development of Forest Park Medical Center. Talk to us a little bit about how you came to the vision of Forest Park.
The National Health Service model in this country is beginning to be pulled through the large institutions. So, in other words, the big institutions are beginning to control their entire referral networks by buying practices and employing physicians. And so I didn't want to be part of that employed service model for a whole bunch of different reasons, not least of which I feel it would interrupt the relationship that I have with my patients. And so if I'm employed by a hospital system, they have the right to tell me what to do and when to do it, and that's not what I wanted to do.
Well, thank you so much for your time, Dr. Genecov.
My pleasure.
And now we'll watch another Forest Park physician help change someone's life.